Hello and welcome to the Surgeon's Barrow. I'm Dr. Shashank Bed, and in today's video, we shall be looking at a few instruments which are commonly asked in NEET PG. Now, instruments, you can definitely expect one question to be asked from instruments in NEET PG, and since this is a topic which is not controversial, this is a topic where you should not get it wrong actually, because the question asked would be straightforward and simple. So, let us look at a few instruments. Now, the idea behind this video is that, see, there is no need for you to become an expert in instruments. There is no need for you to know instruments in too much detail. All you need to know is what the instrument is called, how to identify it, and its most common use. Now, usually what happens is you might get confused in the exam between instruments which look similar. So, I have placed some instruments which look similar together. Okay, now this is a Rampley's swab holding forceps. Now, this was asked recently in the last 2 3 years, and you need to bear in mind whenever you're memorizing instruments, you need to bear in mind that you have to know the name of the surgeon who has come up with those instruments. So, you need to know the full name. So, don't just think of it as swab holding forceps, you call it by its full name, which is Rampley's swab holding forceps. So now, as the name suggests, it is used to hold swab, that is to hold gauze pieces, and it is used to paint the skin with betadine before the surgery. So now, how do you identify this swab holding forceps? So it is typically long, and if you look at the magnified image of this, this is how it looks like. So there is a hole in between, and you can see these fine serrations. Okay, so this is a similar instrument. It's a pile holding forceps. Now, as the name suggests, it is used during hemorrhoidectomy to hold the pile. So now it looks similar to the swab holding forceps. However, both of these instruments have the eye. This is the eye, but this does not have the serrations which were present in the Rampley swab holding forceps. Now, this is a Duval lung holding forceps. So you can look at this shape. It is sort of triangular in shape, and this is used to grasp lung tissue during lobectomy or pneumonectomy. So this is an ovum forceps. It is used to remove placental fragments, small endometrial polyps from the uterus. So now, if you were to look at the magnified image, this looks like a small scoop or like a small spoon. So there's a depression over here, and this is how you identify this instrument. Next, we have something called a Desjardins forceps. Now, Desjardins forceps is used to remove stones from the common bile duct. That is, it is used during choledochotomy for stone removal. So, how do you identify this? So now this is the end of the instrument is very, very thin. So because it is thin, it can enter the common bile duct, and see here also you have a over-like thing, and there is an eye within it. Now, actually, there is no way that you can get confused between this and a swab holding forceps. They look completely different, but if you still might get confused, the finer points are, so if you look at this swab holding forceps, it is quite thick and it has these serrations. But if you look at the Desjardins forceps, it is quite thin, that is, it is fine, and there are no serrations. So moving ahead, next is a pyelolithotomy forceps. So this is what a pyelolithotomy forceps looks like. It is used to hold the stone during nephrolithotomy, pyelolithotomy, or ureterolithotomy. That is, it is used to remove stones from the urinary tract. So here it is roughly right angled in shape, and it is longer. It is long, and you can see these eyes at the end. So next is something called a suprapubic cystolithotomy forceps. So as the name suggests, it is used to hold and to bring out the calculi from the urinary bladder. Now, if you look at this instrument, you will notice that the grip is somewhat different. So there is only one ring, and at the other end does not have a ring. It is slightly different. Now, if you were to zoom in, you would see these fine, sharp teeth-like projections coming out, and these teeth-like projections help to grasp the stone better. Now, this presence of only one ring, this can be a identifying feature of this instrument. However, you can have a suprapubic cystolithotomy forceps where there are two rings. So that is not the only identifying feature of this instrument. So this is a Chittle forceps. Chittle forceps, all of you would have seen this during your internship. Whenever you are doing dressing, it is used to pick sterile articles such as instruments and gauze piece. So you can see so many angles. There is one angle here, and then again there is one more angle here. Okay, so let us look at a few more instruments. So this is a Mayo towel clamp. So this is used in draping to keep the sterile sheets in position. It is used to fix the tubes along with the draping sheets. So what tubes do you expect in the surgery? You might have the laparoscopic tubes that are for the carbon dioxide gas. Then for the light source, you might also have a suction tube. It can also be used to retrieve a broken rib fragment. So this is this is how a Mayo towel clamp looks like. You can see that it is convex in shape, and the end is kind of sharp. It is pointed. Now this is a Doyen's towel clip. As the name suggests, it is used to fix towels during draping. So normally, see in this. So normally in all the instruments, when you put this apart, that is when the instrument opens, right? But in Darwin's towel clip, it is the reverse. So it is when you squeeze this clip inside that this will open. So next we have something called a Moynihan tetra towel clip. Now as the name suggests, it is a tetra towel clip. So it has 4 teeth, 2 on either side. So let us look at this image. This is a Moynihan's towel clip. You can see these 4 teeth, 1, 2, 3 and 4. So next we have something called a barred Parker knife or a BP handle. This is a very commonly used instrument. You would have used this during your first year anatomy and dissection, and you would definitely seen it during your internship. So this is a knife with a detachable blade. So this is important. The blade is detachable, right? Now it comes in various sizes. What is important for your exam is number 3. So for number 3 you have the blade sizes 10, 11 and 15. Number 4 you have these sizes of 22 and 23. An easy way to remember it is the lower number has lower blade sizes and the higher number has higher blade sizes. So this is size number 3, this is size number 4. Now a few blades which are commonly asked in your exam. So this size 11 blade, it is used in abscess, that is IND. It is also used in arteriotomy, that is it is used to make an opening in a blood vessel. Then you have size number 15. This is also commonly asked in exams. Size number 15 is used to make small incisions. So see, the blade size is small, so it is used to make small incisions. Then you have 22, which is a big blade, and this is used to make laparotomy incisions, as is 23. So this image is from Bailey and Love. The sizes which are commonly asked for you in the exam are 11, 15 and 22. Next, let us look at forceps. So this is a tooth forceps. As you can see, when you look at when you magnify it and you look at the tip of the instrument, you can see a single tooth over here. This is the single tooth over here, which fits into a groove in the other end. So a tooth forceps is used to hold tough structures such as skin, margins, linea alba and rectus sheath. Since it has a tooth, so obviously it can damage the structures. So you do not want it to damage fine structures, so you will use it to hold tough structures. Next we have a non-tooth forceps. It is similar to a tooth forceps except that there is no tooth. I mean, it looks similar, and the thing is it is used to hold delicate structures. So next we have the Adson's forceps. Now the Adson's forceps, this also has a small tooth at the end. Now so you might get confused in the exam as to which is a tooth forceps and which is an Adson's forceps. So like I told you in the beginning of this video, the idea is to keep it simple and to even make it silly so that you can remember it. So this is the shape of the Adson's forceps. If you can just observe this outline, this is the shape of the Adson's forceps. So basically it tapers as it goes, it tapers suddenly as it goes towards the tip. So it is broad over here, after which it tapers suddenly. Now if you look at the tooth forceps, it sort of, this is the outline, it's sort of like this and it tapers gradually. So Adson's forceps, since it has a tooth at the end, so it is therefore used to grasp, to hold and to move tissue. So it can be used to hold tough tissue. Now the reason they have a wide thumb grasp is because it gives you increased precision and control. Basically it translates to finer movements while you're holding the tissue, while you're using the instrument. Now this is a Russian tissue forceps. This is a Russian tissue forceps, and you can see how it looks. So there is a clubbed tip. See, it's sort of like a club. The end is sort of club shaped, and you can see it sort of dilating. So it is a club tip in the blades with a serrated inner surface. It is used to hold skin while suturing. This is a Russian tissue forceps. Now Alice tissue holding forceps. So the tip of the blades are provided with sharp teeth. So you can see over here there are sharp teeth. There are grooves in between. So as the name itself suggests, it is a Alice tissue holding forceps. So it is basically used to hold tough tissue. So it is used to hold the inner aspect of the skin to act as retractors. It can use to hold the ends of incision to facilitate skin suturing, to hold skin flaps. Basically, to keep it simple, it is used to hold skin. It cannot be used to hold finer structures because of the teeth, and that will then cause trauma. Now this is a Lister's sinus forceps. Now Lister's sinus forceps is used to drain an abscess via the Hilton's method. So now if you recall, Hilton's method is used to drain an abscess, for example, in the axilla. So basically here you are trying to prevent damage to the underlying structures. There might be a nerve or a vessel present beneath it. You want to protect that nerve. So what happens is you make an incision only in the skin, and when you reach the fascia, you do not incise the fascia with the blade, but you use this Lister's sinus forceps to thrust into the fascia to create an opening. So you can see how it looks in the end. So this is a Lister's sinus forceps. So moving ahead, this is a Babcock's forceps. So Babcock's forceps, basically you can see it sort of becomes round at the tip, right? So when this instrument is closed, it would sort of look like a round thing. Now this Babcock forceps is used to hold the margins of the gut when you are applying occlusion clamps, and it is used to hold cut margins of the urinary bladder or even the appendix. Basically it is used to hold bowel because it is not traumatic. So if you contrast this with Alice forceps, if you recall, had teeth that would translate to trauma while holding the tissue, but a Babcock forceps would not cause that trauma. So moving ahead, we have something called a Lane's tissue holding forceps. Now Lane's tissue holding forceps, just like Alice forceps, this also has teeth, but when you look at the shape of the end, it is sort of different. It is convex and there is an eye at the tip of the instrument. So this is used during submandibular or parotid gland excision to hold the gland during dissection from adjacent structures. This is the first use. One more use, during mastectomy, it can be used to hold the breast when you're dissecting it, when you're lifting it off the pectoral fascia. Now this is a cord holding forceps. So this is used during hernia surgery to hold the structure of the spermatic cord, which keeps them away from the sac and prevents injury to the cord and cord structure. So there is a nice round, it's forming a ring. Next is a right angle forceps. Now right angle forceps is a favorite instrument for oncosurgeons. Oncosurgeons are very good at dissection and they use a right angle forceps to dissect. So it can also be used to pass ligatures to blood vessels to cystic duct. Basically, if you want to tie something and you want to pass a ligature beneath the structure, you will pass the tip of the right angle forceps beneath or posterior to the structure, and then that can be used to pass a ligature. It can also be used to hold bleeding vessels in the depth, and it can therefore be used for hemostasis as well. Now coming to hemostatic forceps, there is something called a Spencer-Wells hemostatic forceps. This is basically the instrument which is referred to as artery in the OT. So it is used to hold the bleeding vessel. It can also be used to split the muscle layers during doing while you're doing an appendicectomy. It can also be used to do blunt dissection. So a Spencer-Wells hemostatic forceps, it can either be straight or it can also be curved. Now just like you had a tooth and a non-tooth forceps and you had an Adson's forceps, similarly you also have a mosquito forceps. Mosquito forceps can also be curved, it can also be straight, just like a Scalpels hemostatic forceps, but these are smaller in size, and these are named so because it has a very delicate tip. This delicate tip, it resembles, if you look at the image of this mosquito, it resembles the proboscis of the mosquito. Basically, it is very slender and thin. Since it resembles the proboscis of a mosquito, it has been called mosquito forceps. This is used to hold fine bleeding vessels. It can also be used to puncture the mesoappendix at an avascular site when you want to ligate the appendicular artery. Next is a Moynihan forceps. A Moynihan forceps is used in open cholecystectomy. Now, a Moynihan forceps, some of you might get confused because you would think that it resembles a right angled forceps, right? But the main difference between a right angled forceps and a Moynihan forceps is so this has, if you look carefully, it has these serrations. A right angle forceps does not have these serrations. Secondly, in the right angle forceps, it forms a, let me just show the right angle forceps. So if you were to look carefully, basically this provides a, this is a sharp right angle, whereas this is slightly more obtuse. So, a Moynihan forceps is used in open cholecystectomy to hold the gallbladder. This is a Mayo Hagar needle holder. It is used to hold the needle during suturing. So, as you can see from the image, there is a groove at the tip of the instrument, and this groove, it helps in better grip of the needle so that the needle does not slip while you are suturing. This is a suture removal forceps. Suture removal scissors, I'm sorry. This suture removal scissors can be used to remove sutures. Now let us look at a few retractors. This is a Journey's retractor. A Journey's retractor, as you can see, at one end it has these prongs, at the other end it is sort of short and broad. So this is used for, as the name suggests, it is used for retraction of tissues for better visualization. The hooked end is used to retract abdominal wall muscles, and the plain end is used to retract the peritoneum. Now this is a Morris retractor. Morris retractor, if you notice, this is slightly broader. This is broader. This is a Morris retractor. Now this is a Kelly retractor. A Kelly retractor is a curved right angle retractor. So basically, you can see this is a right angle, right? So a Kelly retractor is used in deep pelvic surgery, such as in rectal dissection. Now this is a Langenbeck's retractor. Now Langenbeck's retractor is also a right angle retractor, but it is way smaller when compared to a Kelly's retractor. So Langenbeck is also commonly used by general surgeons, and to give one example is, it is used during appendicectomy. As you go layer and layer, deeper and deeper, the Langenbeck's retractor is used for better visualization. Now this is a Devers retractor. The Devers retractor is used during laparotomies. Now these are called Cordman malleable retractors. So if you were to get an image in the exam which looks something like this, it is a or image, or these instruments, these are Cordman malleable retractors. Basically, so see, you can see it being bent in different parts, right? So basically it is malleable, that is, you can bend it. Even here you can see that the light in these instruments, you can see that the light is sort of, see, this is dark, this is light, again this is light, this is dark. So this suggests that the retractor is bent at various places. If you were to look at this image here, you can clearly see the retractor being malleable. Now this is a single hook retractor. So you can see a single hook over here. It is used for superficial retraction of tough structures like skin, fascia. It is also used to raise flaps during a mastectomy. Now since it has a hook, the hook is pointed, they can cause trauma, so it is used for retraction of tough structures. So this is a double hook retractor. So you can see two hooks over here. This is used to retract skin during venesection. When you want to do a venous cut down, you will use a double hook retractor. It can also be used during a tracheostomy. So this is a Volkmann's cat's paw retractor. So it resembles a cat's paw. As you can see, multiple 1, 2, 3, 4. It resembles a cat's paw, and it is used to it is used for retraction of skin flaps or fascia. So these are Volkmann's cat's paw retractor. Now this complicated looking retractor is a Jawl's self-retaining thyroid retractor. Now basically if you were to go back and see the previous retractors such as the Volkmann's retractor, the single hook, double hook, or the Casper retractor, you will notice, or even the Devers and etc., you will notice that those retractors need to be held by an assistant during surgery. So when you become a surgery PG, during your first year, you will be mostly asked to retract. Some of you might have done it during your internship as well. Now supposing, say, if you do not want if you do not have an assistant, if you do not have the luxury of an assistant, and you still want the tissue to be retracted, you want better views, so you would need a self-retaining retractor. So what is a self-retaining retractor? You basically do not need any assistant to retract it. So this is a Jawl's self-retaining thyroid retractor, which is used during thyroid surgeries to retract skin flaps. So an easy way to remember this is, see, in a thyroid gland, this is the right lobe. Sorry, this is the left lobe. The right and left are united by an isthmus. So same thing over here. Imagine this is the right, this is the left, and this is the isthmus. So this is a Jawl's self-retaining thyroid retractor. Now this is a Beckman white liner mastoid retractor. So it looks like this, and this is also self-retaining, as is evidenced by this clasp over here. Now this is used in spinal surgeries, in intracranial surgery, and even in neck or thyroid surgeries to retract tissue. So you can see over here, this is this is when you look at the instrument from above. So you can see the teeth curving inwards. When you reverse the instrument, this is how it looks like. So this is a Beckman white liner mastoid retractor. Now this is a Doyen's mouth gag. This is a Doyen's mouth gag. So this is for the upper lip. This is for the lower lip. Basically, it is used to keep the mouth open during intraoral surgeries. This is a Balfour's abdominal retractor. So now, so this can be used to retract one end of the, maybe this is right, this is left. It can be used to retract the ends of the abdominal, and this is for the angle of the incision. So this is a Balfour's abdominal retractor. It is a self-retaining retractor which is used during laparotomies. Now this complicated looking retractor is called a Book-Walter retractor. No need to go into details. All you need to know is, whenever you get a complicated retractor, it is a Book-Walter retractor. It is used during laparotomies. Now this is a bladder neck retractor. Basically, it is used to retract bladder neck in bladder surgeries. So this and this both are examples of a bladder neck retractor. Now this is a Farabouf's or a Lane's double-ended retractor. This is one end, this is the other end. This is used in laparotomies. Now this is a scapular retractor. This fancy looking thing which looks, if you were to use your imagination, it looks like an S. If you were to use your imagination, just like many surgeons, they can see various animal shapes in X-rays and CT scans. If you were to use your imagination, this looks like an S. So basically, this is a scapular retractor which is used to retract scapula during thoracotomies. Now this is a lung retractor. So if you scroll up, if you go back, if you rewind and see, you will see a Duval's lung tissue holding forceps. And this is a lung retractor. Basically, this is not going to hold the lungs; it is just going to keep the lung away. So you want less trauma to the lungs, right? So therefore, you do not have a single broad retractor. You have various. So there is air in between. There is gap in between. I'm sorry, air is a poor choice of words. There are gaps in between, right? And these gaps, they help to dissipate the pressure and causes less trauma while retracting the lung. So this is an Allison lung retractor. So it does not damage the lung, and lung can expand in between the wires. Now this is a rib spreader. So see, basically you put this in the intercostal space. So maybe this is for the lower rib, this is for the upper rib. You put this in the intercostal space, and as this expands, it can spread the rib. So this is used to retract ribs during lung surgeries. Now patients who have undergone rib retraction during a surgery, they have a lot of post-op pain. So this is the advantage of VATS, that is video assisted thoracoscopic surgery, is that it does not cause the post-op complication of pain which was seen in open thoracotomies. So moving ahead, this is an intestinal occlusion cam. So this is long instrument, and you can see this very long serrations. So this is used to hold intestines, and it prevents. So basically when you hold the bowel in between the clamp, it will occlude the bowel, it will prevent spillage of the contents. It is used during resection and anastomosis. Now this is a Pear's gastric crushing clamp which is used during partial gastrectomy. So it is slightly complicated looking, but when the instrument is open and you see it inside, again you will see these long serrations, right, and at the end there is an eye. Now the idea for no examiner in their right mind is going to ask you very complicated questions from these instruments, and supposing say there is a question which is a bouncer, then all of you will get it wrong or very few will get it right, and that also might be by fluke. So there is no need to go into details, no need to do a PhD in these instruments, right? You just need to know how to identify it. So this complicated looking instrument is a Pear's gastric crushing clamp. Now this is a bulldog clamp. This bulldog clamp is used for temporary occlusion of small peripheral blood vessels. Basically, whenever there is bleeding, um, so this you can use this bulldog clamp. This is one end, this is the other end. It acts via pinch cock mechanism. So just like there was this towel clip, which looked similar. Similarly, as you press it, as you compress it, the blades will go apart. So as this is pressed, this will go apart. So a bulldog clamp is used for temporary occlusion of small peripheral blood vessels. It has a pinch cock action. Now this is a Potts bulldog clamp. This is a Potts bulldog clamp. As you can see, there is a spring action. This also is used for the temporary occlusion of small blood vessels. Now this is a Satinsky clamp. A Satinsky clamp basically is used it can be used to occlude the aorta and IVC. This is a life-saving instrument, and supposing there is an accidental injury, you can use a Satinsky clamp, or even for the larger blood vessels, you can use this Satinsky clamp. It will partially occlude the vessel wall such that blood flow continues through the rest of the vessel. Now coming to scissors. So this is a Mayo scissor. It is used for cutting tough tissues and sutures. So you can see this is heavy blade. It is thick and it is used to cut tough tissues. Now a Metzenbaum scissor on the other hand, this looks very fine, right? So it is used for cutting delicate tissues such as bowel and bladder. It is also used for fine dissection. Now you have something called a Mackindo scissors, which is even finer than a Metzenbaum scissor, and this is used for cutting fine tissues. It is used in ophthalmic and plastic surgery. It is not that commonly used by general surgeons. It is more used in plastic surgery wherever they are doing fine work. Now this is a Lister bandage scissors. So supposing say if a patient has come with a roller gauze or a roller bandage across the limb and you want to cut the bandage. So when I was doing my PG, I used to use a blade to cut it, but sometimes it might cause injuries to the underlying skin. So to be safe, you will use a Lister bandage scissors. So since these blades are bent, basically this allows it to be inserted beneath the gauze and you can therefore cut it. Now, when I was taking class for a few students, when I showed them this instrument, they told me that this looks very similar to an episiotomy scissor. Now, I had no idea what an episiotomy scissor looked like, so I had to Google it, and when I was teaching them the differences, so these instruments look similar. That is the Lister's bandage forceps and episiotomy scissors, they look similar. So, how do you differentiate between the two? So, this episiotomy scissor, if you look at the blade, it is slightly convex. So, the blade on top, it is slightly convex, right? But if you look at the bandage scissors, this is not convex, this is flat. So this is an easy way of differentiating between a episiotomy scissor and a bandage scissor. So next, this instrument is a Kocher's thyroid dissector. It is used during thyroid surgeries to dissect the superior thyroid pedicle. Now there is one more instrument which is named after Kocher, that is the Kocher's hemostatic forceps. So it is used during appendectomy to crush the base. It is used to hold perforating vessels during mastectomy. It can also be used during subtotal thyroidectomy. So if you observe carefully, see there is a tooth over here which goes within a groove. This is the groove over here. On the corresponding end there is a groove. Now the advantage of a, so this looks similar to a tooth forceps, right? But the advantage of a coach's forceps over a tooth forceps is this instrument can be locked. If you look at the ratchet, you can lock the instrument. Therefore it gives a more secure grip. Next is an aneurysm needle. So this is what an aneurysm needle looks like. It is very fine and it is used during venesection to pass a ligature around the vein. Now this is a Doyen's rib respiratory or a costal elevator. So if you were to recall, even the mouth gag was named after Doyen. So Doyen's rib respiratory or a costal elevator is used to remove tissue and cartilage from the ribs. So this is how it looks like. There's sort of a hook at the end. Now, this is a Mayo's vein stripper. This is used in Trendelenburg surgery for stripping the great saphenous vein. Now, this is a punch biopsy forceps. It is a Yeoman punch biopsy forceps. So, just like when you punch holes in a paper, you can see that this end is used to punch a hole in the tissue from where you want to take a biopsy. Basically, there are two short stout jaws on the tip. It is used to take biopsy from rectal lesions like carcinoma, polyps or ulcers. So see, this is a long, it is very, very long. So it can be inserted into the depths of the rectum, but the tip is very stout. It is very, very short, right? So this is a Yeoman punch biopsy forceps. So moving ahead, this is a Humby knife and blade. This is used to harvest a split thickness skin graft. This is the knife and this is the blade. This is a proctoscope. So as you can see, it consists of a sheath and an obturator. So now this is a Brody fistula director. It is used to probe and to treat fistula in ano. So basically when you're doing fistula surgeries, you can see the external opening, but you want to see the internal opening, right? So this probe, this Brody fistula director, it is inserted via the external opening, and it can be used to pass it along the fistula tract, that is within the fistula tract, and wherever the instrument comes out, right, you know that is the internal opening. So next we have something called a periosteal elevator. This is used to elevate and dissect tissue nerves. It is used to expose a fracture site of bone. It can also be used to strip the periosteum. Now this periosteal elevator, some of you might get confused because it looks similar to a Kocher's thyroid dissector. At least I used to get it confused. So therefore I have kept these images side by side. So you can actually see that it does not look similar. I don't know why I used to get confused. Anyway, so this is a Kocher's thyroid dissector. This is a jiggly saw forceps which is used to cut bones in amputation. Now this is a suction cannula. Now all of you can identify this suction cannula, right? But supposing if you are asked in the exam what is a Yankawas instrument, you will not know the name. So just like in a few years ago they had asked you what is a Rempley's forceps used for, even I never knew that. The sponge holding forceps is called a Rempley's sponge holding forceps. So similarly, the full name is a Yankawas suction cannula. So you can see this end, it is connected to the suction equipment. This is the suction tube and this is the tip. Basically it is used to keep the operating field clean. So with this we come to a conclusion of this part of instruments. I have obviously not covered all the instruments. I have tried to cover as many instruments as possible. If you have any doubts, please mention it in the comment section. If you want a video on some other instrument, or if I have missed a particular instrument, please drop it in the comment section. I will try to upload a video. Thank you for watching.